Welcome to Cascade Hernia and Surgical Solutions at Meridian Surgery Center. I'm Dr. Wright and the principal surgeon here. I've been in practice in Puyallup since 1990 and arrived here fresh out of training from Texas A&M and immediately was immersed in the ability to practice medicine. In 1990, the world went to the first Persian Gulf War and most of the surgeons in Pierce County were called up, and I was left manning the trauma hospitals. And for the next 18 years, I did a lot of trauma, did a lot of cancer surgery, and really spent the most of my time at Good Samaritan Hospital and enjoyed practice immensely. But along with that came a lot of sacrifices with my family, and my practice has now evolved into largely an outpatient general surgery practice, where I care for patients who have needs that can be dealt with out of the hospital by and large. And the practice has evolved into a number of arms, one of which is a research arm. We created the Cascade Hernia Institute in about 2010. I've been doing research with pre-med students and medical students regarding hernias during that time, and we publish a paper about every year. And in that 10 years, we've gotten 10 pre-meds into medical school, and I consider that to be a major contribution because it's tough to keep the vision for those young people, and giving them experience and the vision and some guidance in how to make that transition has been very satisfying to me personally. Cascade Hernia and Surgical Solutions is the clinic side where we take care of patients, and I'm not retired. I love taking care of patients. I love doing surgery. I love what I do. So the hernia and surgical solution side, we do largely outpatient general surgery. So that includes hernias, gallbladders, lumps and bumps, melanoma cancers, hemorrhoid surgery, anal surgery, and a smattering of other things that need to be done in the realm of general surgery. The other component of the practice is Meridian Surgery Center. That is a Medicare certified surgery center with a certificate of need from the state of Washington. We get a lot of attention from the Department of Health for all the quality issues, and we passed all those for the last 21 years now. I began that while I was partnered with Cascade Eye and Skin. In 2011, we moved over to our current location on 17th Avenue in Puyallup and have expanded the outpatient services dramatically so that we're operating 3 to 4 days a week at Meridian Surgery Center, largely doing outpatient surgery. My practice involves a number of other important people. Dr. Nelson is a medical doctor who no longer operates, but he sees patients preoperatively. He sees patients in the postoperative status, and he's also frequently assisting during the operation. So he has a very solid feel for what we do. He's a wonderful man and a great asset to the practice. Additionally, Dr. Duras is also operating at Meridian Surgery Center and an integral part of our practice. Dr. Duras was the surgeon I chose when I needed my hernia repaired. That was 10 years ago. And then when my dad needed his hernia repaired 5 years ago, he fixed my dad's hernia. So I've got a lot of confidence in Dr. Duras, very meticulous surgeon, lots of years of experience like myself, and a wonderful guy. Brandon Swisher is also in our practice. He's a physician's assistant. He's been involved in our practice for 8 years. He understands our processes, understands the disease processes, sees patients in the clinic, and also assists in the operating room. So if you see Brandon, he's not a rookie at what he's doing. We've got a wonderful staff. We generally reward longevity, and many times our staff are nurses that are refugees from the hospital that no longer want to be working nights, weekends, and holidays, and they're happy to be working with their skills in the outpatient setting and still get home at the end of the day every day. So we hope that your experience at Meridian Surgery Center lives up to your expectations. We're always pleased to see our 5 stars and 4 stars on our ratings, and we want to live up to your expectations and make your surgical experience less problematic, less worrisome, and certainly successful. Thanks again.